Sunny is a 6-year-old male neutered domestic shorthair cat presenting to the emergency clinic for urinary straining in the litter box with no production. On exam, he had a firm, painful, non expressible urinary bladder, so he was determined to have a full, complete urinary obstruction, which, as we know, is really common in male cats. His owner elected to have him hospitalized so we could check his blood work. Luckily, blood work was fairly unremarkable with just minor signs of dehydration, such as hypernatremia, and signs of stress, such as a stress hyperglycemia. Luckily, Sonny's kidney values were normal, which means that his owner caught this in a pretty early phase. So we're getting everything ready to prep. Make sure you get all of your supplies and anesthetic machine. Of course, sometimes these animals present in critical life-threatening conditions, but Sunny presented in a very stable condition, so we had time to get everything ready. I wanted to go over a couple of different types of urinary catheters that can be used in this situation. A lot of people will use the Tomcat catheters. These are very firm, stiff catheters, so they work well for relieving obstructions in tiny cat urethras. However, they cannot remain indwelling. They can only be used for unobstruction, then they should be removed and replaced with something softer that's better to keep inside the urethra for long periods of time. A red rubber can be used. They're just typically longer than we need for our feline patients, and they're not quite as good for relieving a firm obstruction like you would see with a lot of grit in the urethra or with a large urinary or urethral stone. We ended up using a slippery Sam in Sunny's case, so these can be used for indwelling. Typically, I don't have as much luck unblocking the urethra with the slippery Sam catheter unless it's just a really minimal partial obstruction or just a really small amount of grit in the urethra. But these can be used indwelling and left in for several days. They're pretty comfortable for the patient. Foleys are typically reserved for our larger species, our dogs, smaller dogs as well. You can use the Foley. They have this balloon on the end so that they stay in place really nicely. However, they're not very good for relieving obstructions because they are so soft and flimsy. My favorite catheter for feline urinary catheterization is the Myla urinary catheter. It comes with a stylet in it, so you can use it for unblocking. It'll be very firm when the stylet is in place. And then once you get into the urinary bladder, you can remove the stylet. Then this catheter becomes very soft and flexible, warms up when it's body temperature, and can be left in for several days. So here we're prepping for an IV catheter and blood draw in Sunny's case. He's a very good boy. We did not have to drug him for IV catheter placement, but if you have a very fractious animal, you could certainly give some of your sedatives first before placing this. So we're just prepping the IV catheter site. We'll pull blood from the IV catheter placement to make sure that there are no significant blood work abnormalities. Once the IV catheter is placed, then we're going to sedate Sunny. So in Sunny's case, we gave him buprenorphine for pain, midazolam, which is a benzodiazepine, which works very nice for relaxing the urethra and the urethral sphincter. And we also gave a little bit of propofol, just the smallest amount necessary to keep him comfortable so that we can completely place this catheter without too much trouble. You can see we're hooking up ECG leads so we can monitor his heart rate and rhythm. He's got flow by oxygen. Do not forget to lubricate cat's eyes. They are sensitive to corneal ulceration when sedated. We're going to place a blood pressure cuff as well. And if the patient is intubated, of course, hooking up to end-tidal CO2 monitoring is important. Cat prepuces can be very, very sensitive to clipping, so just be cautious. I'm doing this very gently to make sure I don't scab up his skin. Once we have him prepped, we're going to put him in dorsal recumbency, and then we're going to elevate his legs and extend his legs towards his head to make it easier to be able to retract the prepuce. So you can see here, we're retracting the prepuce to help get visualization of the actual penis. This is typically the hardest part of the urinary catheterization. I know you can't see so well because the lighting is off here, but we're using a bright light so that we can try to insert the slippery Sam into this tiny little urethra. So the key here is making sure the cat is positioned and anesthetized properly. Once the doctor gets the catheter into the distal penis, Then I have them flip over into lateral recumbency, and we use a gentle twisting motion to advance the catheter. You can also use sterile saline to try to flush the urethra if you need to. But you can see here that once we move the cat into lateral position, then the technician is able to retract the prepuce caudally, pull the prepuce caudally to try to straighten out that urethra. Then the catheter goes in very easily. We attach a syringe to the catheter to confirm that we're in the bladder, and we are. We get nice urine, nice yellowish looking urine. Once we have the catheter into the urethra, you may want to flush the bladder. You may not need to do that, but now we're going to go ahead and secure this urinary catheter in place so that it does not come out. That typically requires multiple sutures. Use a non-absorbable suture, usually 3-0 works well for most cats, making sure to not make the suture go through the penis itself. You want to just grasp the prepuce itself. So here we've got a cap on and we're attaching to the closed collection set. You can see that we're still in the bladder, so we're getting the urine out. And you can see the 2 sutures that are holding this catheter in place. Now we're going to do some imaging to see what the bladder looks like. Here you can see a lot of echogenic debris inside of the urinary bladder that's floating around. This is likely crystalline material. We're actually flushing some sterile saline in to see if we can see any stones and to confirm placement in the bladder. This is a close-up view of some shadowing structures here. This cat actually had multiple small bladder stones that we could see on ultrasound. So I'm a little bit hesitant to believe that this cat will improve with just catheterization alone. This cat probably needs a cystotomy. Here's another video showing the crystalline material and the shadowing bladder stones that are in the dorsal urinary bladder. You should always confirm placement of your urinary catheter properly with your radiograph. I actually cannot see any obvious bladder stones on this image, so that's where ultrasound can be really helpful. But the white arrowhead is pointing to the urinary catheter, and the red marker is outlining the urinary bladder. We can see a little radiolucent circle inside the urinary bladder. That's air from inserting some saline into the bladder.